Hi, we'd like to introduce you to Regenerate Medical Arts, which is a division of Regen MDs.
I'm Dr. Leslie Pace.
And I'm John Pace. When I was in my early 50s, I was diagnosed with bone-on-bone hips from a lifetime of restless leg syndrome, which has degenerated both of my hip sockets. We figured before we do this on anybody else, let's do it on me first. And we had 4 specialists beside Dr. Leslie that saw my bone-on-bone hips in an x-ray and were like, double hip replacement. I'm taking 5-6 Advil a day to manage my pain. It felt like I had 2 giant daggers, one stuck in each hip, especially going up and down stairs. And I had no choice but to take the Advil to manage the pain. And she's like, honey, you can't sustain that. It's going to destroy your stomach lining. It's going to affect your organs. After having 25 years as a medical doctor, Dr. Leslie being an anesthesiologist and specialist in pain medicine, we were looking for other alternatives that didn't quite fall into that pain Western medicine bucket. Whereas cortisone, steroids will do damage to healthy tissue, increase the risk of osteoporosis. And
we decided that we could help to regenerate patients' bodies rather than to degenerate patients' bodies with steroids.
So I said, well, let's try this regenerative medicine, the stem cell therapy. So she harvested my body's own mesenchymal stem cells. It'll be exactly 11 years this Memorial Day. And the most remarkable thing happened. I got treated that day. This is the promise that I have for people that are looking for an alternative to not only surgery, but also harmful addictive pain medications. And I'm proud to say, and I'm happy to report that the day after treatment, now please, I don't want to give any false expectations. I'm just telling you my own personal experience. And it's happened for many of our other patients in 11 years. But the day after that I had the procedure, she injected both of my hips and then she infused me intravenously with my own mesenchymal cells. The next day, I was able to stop taking Advil for the first time in a few years. I was pain-free. I was able to walk and get around. I'm 64. I work out very rigorously. I can do full squats. I mean, I'm not really limited, but man, when you talk about 15 years suffering, 11 years not suffering, being functional, and not having to go through double hip replacements, and not only would I have had to do it once, but typically they say that hip replacements last for about 10 years. I would have been on my 2nd round of double hip replacements. We're not here to make any claims. We let our patients speak for ourselves.